Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Steyer, and today we're going to be talking about the COVID vaccines. Yesterday, we chatted about flu, so why not talk about the other big respiratory vaccine available for our kiddos? The clock is ticking, so let's get to it. So why should kids get the COVID vaccine, and what are the current recommendations? The short answer is because it protects them. So kids may not get as severely sick as adults, but they're certainly not immune. The COVID vaccine helps protect them against severe illness, hospitalization, and death, which I know is so difficult for us as parents to even comprehend. It also protects against complications like MIS-C and long COVID. The CDC recommends the vaccine for everyone aged 6 months and older. And if your child has already had COVID, they should still get vaccinated to boost their immunity. And we'll talk about the timing in just a second. So what's the difference between Novavax and the mRNA vaccines like Pfizer and Moderna? The mRNA vaccines use a tiny piece of genetic material to teach the body how to fight the virus. Now, just a note about this, the mRNA technology is not new. It has been studied for over 3 decades now, but this is the first mRNA vaccine that has been approved for the public. Now, Novavax is a bit different. It's a protein-based vaccine. So instead of using genetic instructions, it gives the body a protein fragment to react to. Both types are effective, but the technology is different. This can matter for people who might have had side effects from mRNA vaccines or those who prefer more traditional vaccine methods. And it is worth noting that in some of the clinical trials, there are some data that show that the reactogenicity, which is basically how our bodies react to the vaccines and the side effects that we experience, can be a bit milder for Novavax. However, it is worth noting that Novavax is currently only approved for children aged 12 years and older, whereas the Pfizer and Moderna options are approved for kids 6 months and older. So when should your child get vaccinated after a COVID infection? You should generally wait at least 3 months, but no more than 8 months after a COVID infection before getting your child vaccinated. This is because their natural immunity is still high right after infection, and waiting a bit longer can actually lead to a better, longer-lasting immune response. But again, do not delay too long. Make sure you get the vaccine when the time is right. My kids and I and my husband, we all had COVID in mid-July of this year. So we'll be getting our COVID vaccines around November in order to have ample protection through the holiday season. Can the COVID vaccine be given with the flu shot? Yes, you can get both shots at the same time. It's safe and certainly more convenient, especially as we are currently entering into flu season. So this will help ensure that your child is protected against both viruses, which is super important as we see flu and COVID circulating together. And finally, does the COVID vaccine protect against long COVID and MIS-C? So I talked about this briefly at the start of the episode, but yes, emerging research and data suggests that vaccinated people, including children, are less likely to develop long COVID or MIS-C, which is an inflammatory condition. This is another compelling reason to vaccinate. It's not just about preventing the initial infection, it's about reducing the risk of these longer-term and potentially chronic complications that can seriously impact a child's health and quality of life. All right. Well, I hope you learned something today, and we have lots more to share. You can get your daily bite of health every day, Monday through Friday. If you like what you've heard here, please let us know. Leave us a review and be sure to tell your friends. Remember, there is no single or best way to parent, and we are all just doing our very best. Wishing you happy, healthy, and stress-free parenting.
From the terrifying power of tornadoes to sizzling summer temperatures, AccuWeather Daily brings you the top trending weather-related story of the day, 7 days a week. You can learn a lot in just a few minutes with stories about impending hurricanes, winter storms, or even what not to miss in the night sky. So listen and subscribe to AccuWeather Daily wherever you get your podcasts. That's AccuWeather Daily wherever you get your podcasts.